I'm going to show you how to manage the questionnaire. We have 3 questionnaires. One is the medical, another one is the chief complaint, and another one is vitals and allergy. So let's start with the medical. Medical, we have all these questions, and we can remove some of them because it's not mandatory by NABID to keep all of them. That's number 1. Number 2, we can keep some of them to be sent to the patient, or we can remove them. And this is why you have a background yellow or no background in that case. The second one is the chief complaint. The chief complaint is done by you. So we propose to you a certain number of things. You will keep them or you will remove them. I'm going to show you how we can do that. And the third one is the vitals and allergy. Vitals and allergy, for a dentist, no need to know about the respiration rate, for example. So this will not be displayed in the files you are going to send to the patients, okay? So only we will keep the blood pressure, systolic, diastolic, and in allergy, we will keep allergy to medicines and to food. You can add more, but in the allergies and vital, you are not allowed by NABID to remove some of these questions. So where do you find this? You find this in utilities, medical questionnaire. And in the medical questionnaire, for example, I want to add allergy to malation. So allergy to malation, I click here, and it will be added in the list we are going to send to the patient. I update, and now I have this. There is a background, and showing this background, this will be sent to the patient. I'm going to show you how we do that. So we go to allergies, we go to vitals. Vitals, I need to keep only 2, but I cannot delete. There is no delete here. I cannot delete body temperature. I need to keep it. So, and then we go to hypertension in medical, and in that I can delete if I want. In the dental, you can delete all what you want. You can ask 4 or 5 questions based on your practice and what you want to search, okay? If you are an orthodontist, you would not be able to work on my breath smells bad, okay? So some of that, you will remove them. Some of them, you will keep them. So this is allowed by NABID, and you can change all that, or you can delete, or you can add a new questionnaire. Let's go now. Let's go to the patient's file. On the patient's file, we are going to click on a patient, and we send patient's details. We ask the patient to fill the details. I copy that. It can be sent by email, it can be sent by WhatsApp, whatever you want. And here is the questionnaire. You have the personal data that we are interested by the chief complaint. The chief complaint, we've been keeping all that, but we can remove that, you understand? The medical questionnaire now is short. Instead of being very long, it is short. It goes to the essential. We can remove more if needed. The vitals, we have only 2 lines instead of 6 lines. And the allergy, we have 3 different lines. That's it. We've been adding the malation, and you see that the malation is there. It is displayed. If we want not to display it, you know how to do now. So doing that, the patient will submit, and submitting will go to the patient's file. Good one. And when we go here, we see that we have the systolic, we have the diastolic, we have the allergy to penicillin, we have the cholesterol. All this was implemented in the questionnaire by the patient. So when the patient comes to the clinic, everything is done in a good way, and the patient will receive an email showing that he's been doing things in a good way, and you will receive an email that he has been able to update his file. I thank you for your attention.